Hello everyone, I'm Yu Xinggong, and today my topic is COVID-19 treatment Remdesivir. As scientists race to develop medicines and treatments for COVID-19, there is one drug that has been getting a lot of attention, Remdesivir. The Food and Drug Administration (FDA) has granted emergency use authorization to use it to treat the new virus. And Remdesivir is an antiviral drug that was originally meant to fight the Ebola virus after an outbreak started in 2030, but it was so ineffective that it was eventually shot. However, despite its initial failures, Remdesivir was later shown to be effective against both SARS and MERS, and is now being tested in new clinical trials as a potential treatment against COVID-19. How does Remdesivir work? Like most antiviral drugs, Remdesivir works by preventing the virus from making copies of itself. Instead of blocking virus receptors, Remdesivir goes right after the head of the virus. Its RNA and the polymerase enzyme that it uses to make copies of itself. Remdesivir is a nucleotide analog that mimics adenosine, one of the four building blocks of RNA and DNA. When a virus infects a cell and started making copies of itself, Remdesivir is instead using into the viral genome instead of adenosine. Once Remdesivir nucleotide has inserted itself, the virus can try to make a copy of its RNA, but it won't be able to. The presence of Remdesivir stops a clinical replication process that in its tracks. If the coronavirus cannot multiply, its devastating respiratory effects effectively neutralized. Remdesivir may also have one other benefit. It likely won't hurt the patient's other cells because it targets not just the virus. One of the reasons that antiviral that specifically targets the viral polymerase is promising it because it should not have negative effects on the cell but will shut down virus synthesis specifically. So is Remdesivir effective? When COVID-19 exploded globally, Remdesivir was dusted off and used as a last-ditch treatment for some of the first COVID-19 patients in the United States. Data from a coronavirus drug trial, the National Institute of Allergic and Infectious Disease released showing COVID-19 patients who took Remdesivir usually recovered after 11 days. Those who didn't take the drug took an average of 15 days to recover. The first reported patient in the U.S. to contract COVID-19 was a 65-year-old man who had visited Wuhan, China. He began developing symptoms consistent with COVID-19 in early January shortly after he returned home from his trip. After 6 days in the hospital, his symptoms had worsened significantly and he developed pneumonia severe enough that he required supplemental oxygen to survive. As such, the man's doctors received permission for the compassionate use of Remdesivir, and within a day, the patient's condition improved dramatically. 3 of the first 12 patients confirmed to have COVID-19 also be treated with the compassionate use of Remdesivir. All 12 patients survived, though due to the circumstances, it's impossible to know whether the patient would have survived without antiviral medication or not. A Chicago hospital that has been testing Remdesivir on severe COVID-19 patients in a closely watched clinical trial and reported highly promising results, including rapid recoveries in fever and respiratory symptoms, with nearly all patients discharged in less than a week. according to a report from state news. And federal trial found that Remdesivir may be able to treat the virus, though that data had yet been peer-reviewed. Trump administration officials hailed finding as a success, with President Donald Trump saying that drug proves there's a light at the end of the tunnel. So what happened next? These early cases suggest Remdesivir may be a viable treatment option, but further studies is needed. Clinical trials in China had already on the way, but the full result of these studies haven't been released yet. Though the FDA has given emergency use authorization for Remdesivir, the drug hasn't been as thoroughly studied as FDA-approved drugs, and the result of the National Institute of Allergy and Infectious Disease study have not been peer-reviewed. Even if Remdesivir is approved for use, Gilead will still face production and distribution challenges, as the drug will almost certainly be in high demand. In fact, those challenges have already arisen. So this is something about the treatment of COVID-19, Remdesivir. I hope it is useful. Thank you.